Dr. Rogers and Madison are both here today. Welcome to you both.
Welcome. Welcome back. Nice to see you.
I'm so glad we're talking about this because after an acute traumatic event, obviously the whole focus is how do we keep Madison alive? And yet now we're able to address some of the reality, some of the sequela of that because, you know, you're a beautiful young lady.
Thank you.
And I know that must have been very difficult for you. So you're on the other side of it now. How are you feeling, first of all?
I'm feeling great. I'm still in recovery, but I can't wait to be done.
That's right. Just
so
a few weeks since you had the reconstructive surgery with Dr. Rogers. Come on over, Dr. Rogers, and show us a little more clearly exactly what you did. So your first step, you're removing the scar. You want to take us through this?
Sure, absolutely. So that scar comes out. Now, just by removing that scar, the skin can stretch now. So we immediately doing that, we got a little more length.
And then you went in there, and what did you find?
All right, we separated the skin and the subcutaneous tissues, the fat layer, and now you're looking at the muscle. There's actually fascia over this, so what it really looks like is more of kind of white, but the muscles are on both sides. Hernias. Fixed it in the more traditional way initially, which is just sewing over them, just like this. But then, in addition to it, I did what we do as plastic surgeons.
And we actually do a tummy tuck.
Exactly. Within a tummy tuck, we do this, but for her, we did it for a different reason. We over-sewed the muscles. So we brought the muscles over the top of these closures. So now it's a double closure. So the chance of it happening again is extremely small.
That's the key point. Bring those anatomic layers back together again. And then finally, you did what we do as plastic surgeons, that fine plastic surgical closures so you can get Madison back into her bikini, right?
Absolutely.
So at this point, I do want you to spend a little time on this Z-plasty to show us exactly what you did there.
So essentially, if this were the incision, which obviously that's where we ended up with the closure, to design it, we essentially do that. And these two little Z's, these little flaps, come up and they transpose, they interpose. So you end up with... Now this is just accentuated for the purposes here.
But to give you a couple, so you've gained length.
Yes.
And you've changed the direction of the scar a little bit to break up that straight line, which the eye picks up.
Scars do have a tendency to tighten. Even this one will to some degree. This breaks it up so it won't tighten only in this direction.
Looking good.
Once you have that new scar, let's go back over and talk to Madison. You're probably wondering what's this going to look like 2 months from now, 3 months from now.
Yeah.
I'm just hoping I can continue to stand up like I did.
That's a very good point, though. Because we were able to remove that, close it primarily, the chance of getting a thick scar is much less. Now, if she starts to form a thicker scar again, we can do things like inject it with cortisone. Kenalog is a particular type of cortisone. You can inject in there, and it'll help prevent the scar from thickening as much.
And your mom is here with us. We saw her in the tapeys. So, Randy, you're out there. So, what's it been like going through this experience, watching your daughter not only end up in the ICU, but the sequela of afterwards?
Well, it was a horrible experience that no mother should go through. And I'm just grateful that she survived. But I'm going to be more thankful that she's actually going to be able to get back to her normal life, being able to do what moms do.
Well, and it's hard to believe that a short while ago you were in that horrific accident. I think you're living proof that sometimes it takes a little while, but that if you persevere, that in the end, you know, you're going to end up, you never want to say as good as new because you may end up better than ever. You know, this is one of those things you learn from, and you look fabulous. Thank you so very much for joining us. Dr. Rogers, great job.